The hidden danger why falls aren't just accidents. Let me tell you something most doctors won't say out loud. Falling is not normal aging. It's common, but it's not inevitable. And it's not something we should ever brush off. Because the truth is, one fall can change everything. I've seen it too many times in my 50 years of practice. A proud, independent person takes the wrong step. Maybe on the stairs, maybe in the bathroom. And suddenly, they're in the hospital, facing surgery, rehab, and a mountain of fear. Not just fear of pain, but fear of losing their independence, their home, their confidence, and worst of all, fear of falling again. The Centers for Disease Control and Prevention reports that every year in the United States, 1 in 4 adults over the age of 65 experiences a fall. That's more than 36 million falls every year. And sadly, over 3 million of those end up in emergency rooms. But here's the most important thing I want you to hear today. Most of those falls are preventable. They don't happen because someone is clumsy or too old to function. They happen because the body has been quietly losing its ability to protect itself. Muscles get weaker, balance gets poorer, vision fades, medications stack up, nutrition gets sloppy, and slowly, the ground seems to rise up faster than we can react. But if we understand why older adults fall, we can build a real, practical plan to stop it before it starts. This isn't about wrapping yourself in bubble wrap. It's about taking your power back. Because every time you stand, walk, or turn your muscles, brain and senses are working together to keep you upright. And with the right food, the right movements, and the right awareness, you can rebuild that system stronger than ever. In this video, we're going to break it down step by step, why your balance changes as you age, which medications secretly increase your risk, what's happening in your muscles, eyes, and brain that makes falling more likely, and most importantly, what you can do starting today to stand tall again. Comment below, have you or someone you love experienced a fall in the past year? How did it change the way you move or the way you feel about movement? Let's talk about it because healing starts with understanding, and you deserve to feel safe in your own body. Number 1, how aging affects balance and coordination. Here's something no one tells you when you turn 60. Your sense of balance is not just about your feet, it's about your eyes, your inner ears, your brain, your muscles, your joints, and how all of them work together in milliseconds to keep you upright. The problem is, as we age, almost every one of those systems starts to slow down. Not because you did something wrong, but because time changes the way the body communicates with itself. Let's break it down. 1. The brain-to-body delay. When you were 30, your brain could sense a shift in balance and tell your legs to adjust in the blink of an eye. But now that signal may be slower or less accurate. The neural pathways that once fired like lightning bolts are now more like dial-up internet. That means when you trip, your body may not react fast enough to catch you. 2. Muscle loss, ducker, less support. Remember that strong feeling you had in your thighs and hips when you were younger? Those muscles are your primary shock absorbers, the ones that stabilize you during steps, turns, and sudden changes in terrain. But starting as early as your 50s, you begin losing up to 1% of muscle mass per year unless you actively fight back with resistance training and nutrition. And with less muscle comes less balance. 3. Joint stiffness and limited mobility. As joints age, they get stiffer. The ankles and knees critical for quick adjustments lose their flexibility. Imagine trying to catch yourself from falling with rusty hinges. That's what tight joints feel like. And when you combine that with weaker muscles, it's a recipe for imbalance. 4. Declining vision and spatial awareness. You don't just balance through your legs, you also balance through your eyes. They help you judge distance, detect motion, and find safe footing. But with age, you may lose depth perception. Peripheral vision. Narsur. Night vision. If you miss that curb, that rug edge, that step, The body doesn't always get enough time to respond. 5. Inner ear degeneration. Inside your ears are tiny canals filled with fluid, your vestibular system. They detect head movement and help your body stay oriented. But with age, this system weakens. That's why so many older adults feel dizzy, disoriented, or floaty even when standing still. And dizziness, plus weak legs, danger. The balance equation. Balance is not a single skill. It's a team effort, a harmony of your brain, muscles, joints, eyes, and ears. And if just one piece is off, the whole system feels it. But here's the empowering part. You can train it, just like muscles. Your balance systems respond to targeted exercise. Daily practice. Nutrient support. Environmental awareness. This isn't about getting younger. It's about getting smarter about how your body now works and what it needs. Comment below. Which part of your balance feels most affected these days? Is it your legs, your eyes, or maybe that dizzy feeling? Let's start connecting the dots and reclaim your stability, step by step. Number 2, medication mistakes, the trigger falls. There's something that silently increases fall risk in older adults, and it often comes with a prescription label. Medications, not just one, but the way multiple medications interact inside an aging body. This is what we call polypharmacy, when someone takes 4 or more medications regularly. And while each drug might serve a purpose, together, they can quietly tip the scales toward instability. Some medications affect balance directly, others slow reaction time, cause drowsiness, lower blood pressure, or confuse the brain. And even medications that once felt safe in your 50s can have very different effects in your 70s or 80s because the body's metabolism slows down with age. Over time, these subtle side effects can make the difference between staying upright and falling. What's worse, most older adults and even caregivers don't always connect the dots. They might notice more fatigue, slower walking, or dizziness, but do not realize it could be their current medication routine that's changing how their body functions. This is why regular medication reviews are essential, especially for adults over 65. Every 6 to 12 months, a healthcare provider, ideally a geriatric-trained doctor or pharmacist, should go through every medication, including over-the-counter and supplements, to assess, is this still necessary? Is the dosage right for your age? Could this be replaced with a safer alternative? Are there new side effects showing up subtly? Because the truth is, not all falls start with a trip or a slippery floor. Some begin quietly, with a single pill, taken daily, that slowly changes how the body moves, balances, or responds. And the first step in reclaiming your strength might be as simple as reevaluating what's in your medicine cabinet. Comment below. Have you ever reviewed your full medication list with a doctor, including supplements and over-the-counter items? Let's make sure what you take every day is helping, not quietly holding you back. Number 3, vision, hearing, and brain fog. The overlooked fall triggers. Most people think falling happens because of weak legs or slippery floors, but the truth is, your eyes, ears, and brain might be the real problem. Not because they've stopped working, but because they're no longer communicating fast enough, clearly enough, or consistently enough to help you react in time. This is the silent danger, the one no one talks about until someone you love trips over a rug, or misses a step, or can't explain why they fell. Let's look at 3 of the most overlooked systems in fall prevention and why they matter more than you think. 1. Vision decline, your body's GPS fading out. Your eyes are not just for seeing, they help you orient yourself in space, they judge distance, detect depth, and help you find safe footing. But with age, common changes include reduced contrast sensitivity, narrowed peripheral vision, poor depth perception, increased light sensitivity at night. This means you may not notice the edge of a rug, misjudge a step, struggle to adapt when moving from light to dark areas. These small errors can lead to big consequences, especially when paired with muscle loss or balance issues. 2. Hearing and the inner ear, your hidden balance system. Deep inside your ears lies the vestibular system, a network of canals and nerves that detect motion and spatial orientation. It tells your brain where your head is, even with your eyes closed. With age, this system degenerates naturally, leading to dizziness, unsteadiness, a sensation of spinning or floating. These symptoms may come and go, but they quietly erode your trust in your balance. And if you also wear hearing aids, you may struggle to localize sound, which delays your body's ability to respond to danger from behind or the side. 3. Brain fog, slower processing, Schasser's slower reaction. Cognition plays a big role in physical safety. Your brain processes what your eyes see, what your ears hear, and what your body feels then tells your muscles how to respond. But if that system slows down due to mild cognitive impairment, medication, poor sleep, or even dehydration, your reaction time suffers. You may know you're off balance, but you react just a second too late, and in that 1 second, the fall happens. Putting it together, your body's stability is not just about strength, it's about synchronization. When your eyes, ears, and brain are out of sync, the rest of your body is forced to guess, and that guesswork is risky. So what can you do? Get annual vision and hearing checks. Use proper lighting throughout your home. Stay hydrated. Talk to your doctor about any dizziness or brain fog, even if it seems mild. Practice balance drills with your eyes closed to retrain the brain-body connection. Because staying upright isn't just about being strong, it's about staying connected inside and out. Comment below. Have you noticed changes in your vision, hearing, or focus in the past year? How have those changes affected your balance or confidence? Let's open this conversation and make the invisible risks visible. Number 4, nutrition and muscle loss. How weak legs lead to a fall. You may not feel it happening. It's not painful. It doesn't announce itself, but slowly, quietly, your muscles shrink, especially the muscles in your legs, hips, and core, the very ones that keep you upright, balanced, and steady. This gradual weakening is called sarcopenia, the age-related loss of muscle mass and strength. And while it's a natural part of aging, it's not inevitable. You can slow it down. You can even reverse it with the right nutrition and movement. But here's the catch. Most older adults don't eat enough to support their muscles, not enough protein, not enough key nutrients like vitamin D, magnesium, or calcium, and not enough consistency to make a difference. Instead, many skip meals, snack on empty carbs, or eat light because they don't feel hungry. But when you eat less, you don't just lose weight, you lose strength. You lose the very tissue that catches you when you slip. Why protein matters. Protein is not just for bodybuilders. It's for anyone who wants to stay out of a hospital bed. Your muscles need essential amino acids, especially leucine, to rebuild after stress, repair daily wear, and grow stronger. Experts recommend that adults over 60 aim for at least 1.0 to 1.2 grams of protein per kilogram of body weight per day. That means if you weigh 150 pounds, you need around 68 to 82 grams of protein daily spread out across all 3 meals. Without it, your muscles literally begin to melt. The role of micronutrients. It's not just about protein. Vitamin D helps muscles contract properly. Magnesium supports nerve signals to prevent cramping. Calcium helps prevent bone fractures if a fall does happen. B12 protects balance and coordination. But many seniors are low on these because of medications, reduced absorption, or lack of appetite. And with each missing nutrient, the legs grow weaker, the balance gets shakier, and the risk of falling climbs higher. Hydration, the overlooked risk. Dehydration causes fatigue, low blood pressure, and even confusion, which all increase the chance of falling. Older adults often forget to drink water or avoid it to prevent nighttime bathroom trips. But your muscles are over 70% water. If you're not hydrated, you're not stable. Aim for 8 to 10 cups of water per day and more if you're active. Nutrition isn't just about feeling full. It's about fueling your muscles to protect you. Every bite you take either strengthens your foundation or weakens it. And when your legs are strong, your risk of falling drops dramatically. Comment below. Are you eating enough protein for your age and body weight? What's one food you'll add this week to help fuel your muscles better? Let's build strength from the inside out so you can stand tall, move confidently, and live fully. Number 5. How fear of falling increases the risk. Let me ask you a personal question. Have you ever caught yourself thinking, I better not walk there, just in case I fall? Or maybe you avoided bending down, climbing stairs, walking outside alone, not because you couldn't, but because you were afraid you might fall. If so, you're not alone, and you're not wrong for feeling that way. But I want you to hear this: fear of falling can make you fall. Let me explain. Fear, less movement, weaker body. After just one fall, or even a close call, many older adults begin to limit their activity. They walk less. They avoid uneven surfaces. They hold onto walls or furniture. They stay home more. At first, it feels safer, but over time, this avoidance leads to muscle loss, stiff joints, poor balance, slower reaction time, which ironically makes you more likely to fall. This cycle is called fear avoidance behavior, and it's more dangerous than most people realize. Fear shrinks confidence and quality of life. It's not just about physical strength. Fear affects your mental well-being. You may stop going to church, avoid family outings, say no to things you used to enjoy, not because you don't want to, but because you're scared of what might happen. That isolation can lead to depression, anxiety, and more frailty, all of which increase fall risk even further. So it becomes a loop: fear, less movement, weaker body, more fear. But here's the truth. You can break that cycle. Courage begins with small action. The antidote to fear is not denial, it's confidence through consistency. Start with gentle leg strengthening exercises, holding onto a counter while doing mini squats, balance training for just a few minutes each day, talking openly with your doctor or physical therapist. Also, create a safe home environment where you feel secure moving. The more confident you feel in your space, the more you'll move and regain your strength. It's not about pretending fear doesn't exist. It's about not letting it decide how you live. You have every right to feel afraid after a fall. That fear is your brain trying to protect you. But you also have the right to reclaim your freedom and rebuild trust in your body. Comment below. Have you ever stopped doing something you love because you were afraid of falling? What's one small step you'll take this week to move through that fear, not away from it? Because courage isn't the absence of fear, it's moving forward in spite of it. Number 6, safe movement, daily habits that cut your fall risk in half. If I could give you one tool that cuts your fall risk in half, it wouldn't be a cane or a pill or even a fancy piece of exercise equipment. It would be a movement, simple, daily, intentional movement. Because the truth is, your body was designed to move. And the more it moves with strength, control, and awareness, the better it protects you from falling. Let me be clear. You don't need a gym, you don't need to sweat buckets, and you don't need to train like an athlete. You just need to move with purpose every single day. Consistency beats intensity. A few minutes a day is worth more than an hour once a week. Your brain and muscles learn best through repetition. They need reminders, not punishment. You're training your body to react faster. Stay upright longer. 1 year from. Recover balance with confidence. This is fall prevention from the inside out. The 3 movements I teach all my patients. You don't need 15 different exercises. You need 3 types of movement practiced regularly. Leg strengthening to power your steps, e.g., sit to stand from a sturdy chair. Balance drills to train stability, g, standing on one foot near a counter. Ankle mobility to react on uneven ground, G. Gentle heel raises. Even just 10 minutes per day can activate the systems that keep you safe. The key is consistency, not perfection. Train the mind-body connection. Balance is not just physical, it's neurological. You're teaching your body how to communicate better eyes, brain, muscles, correction, simple drills like heel-to-toe walking, turning your head while walking, closing your eyes while standing still. These challenge your brain to stay alert, so you're not caught off guard when the real world throws you a curve. Make movement part of your environment. Leave reminders around the house. A resistance band by the TV. A printed balance drill on the fridge. A yoga mat in the living room corner. You don't have to change your lifestyle. You just have to integrate smart habits into it. The goal isn't perfection, it's daily momentum. You don't lose balance because you're old. You lose it because no one taught you how to maintain it. Now you know better. Now you can build it back. Comment below. What's one simple movement you'll try today to support your balance? Leg lifts while brushing your teeth. Sit to stand after breakfast, your body is listening. And every small step you take is one giant leap towards staying safe, steady, and strong. Number 7, the home environment where falls happen. Most. You might think the most dangerous place for a fall is outside on a sidewalk, in a parking lot, or at a busy store. But for older adults, that's rarely the case. Over 80% of serious falls happen inside the home. Yes, the very place we feel safest. Why? Because we're comfortable there. We stop paying attention. We move around without thinking. And over time, our home turns into a maze of small, invisible hazards, rugs, dim lighting, slippery floors, cords, pets, cluttered hallways, unstable chairs, bathrooms without grab bars. None of these seem dangerous until you lose your balance for just 1 second. Step 1, fall-proof the floors. Start with what you walk on. Remove loose rugs or secure them with non-slip pads. Clear walkways of boxes, shoes, or electrical cords. Avoid waxed floors, they're slippery even with good shoes. Make sure flooring is consistent, no sudden transitions between carpet and tile. Step 2, light up every room. Our eyes change with age. Dim light makes it harder to spot obstacles, stairs, or pets. Install nightlights in hallways and bathrooms. Use brighter bulbs in commonly used rooms. Place a lamp by the bed you can reach without standing. Consider motion-activated lights for nighttime trips to the restroom. Step 3, safe furniture and support. It's easy to forget how many times a day we rely on chairs, couches, and countertops. Make sure chairs are stable, with firm armrests. Avoid soft, low couches that are hard to get up from. Install grab bars in the bathroom near the toilet and inside the shower. Use non-slip mats inside the tub or shower stall. Step 4, set up for memory and confidence. Falls don't just come from physical weakness, they also come from mental distraction or confusion. Keep essentials in familiar places. Use labels for items you use often. Avoid rearranging furniture unnecessarily changes. Confuse the body's natural map. If you're recovering from a fall, set up a safe walking route around your home. Your home should be a place of peace, not hidden danger. You don't need to renovate your house. You just need to make it work with your body, not against it. Small changes can save your independence. And you deserve to feel safe where you live, where you sleep, and where you move. Comment below. What's one thing in your home you're going to fix, move, or change this week to prevent a fall? Let's help each other fall, proof our lives one room at a time. Let me say something that may surprise you. Most falls are not caused by one big mistake. They're caused by 1,000 little things no one told you to look out for. You weren't taught that walking less could make you more likely to fall. You weren't warned that a rug edge could be more dangerous than a staircase. You weren't told that your blood pressure medication could make your legs wobble at night. But now, you know. And knowledge, at your age, is not just power, it's protection. You have the power to adjust your home, to move with purpose, to eat for strength, to speak up when something feels off, and yes, to question what's in your medicine cabinet. Because what we take every day, those pills we barely think about, can slowly change how our body stands, balances, and recovers from stumbles. That's why in our next video, we're diving into the 10 most common types of medications that increase your fall risk, not to scare you, but to empower you to have smarter conversations with your doctor. What you don't know can hurt you, but what you learn and act on can protect everything you care about. Comment below after watching this. What's one thing you're going to check, fix, or start doing differently today? Is it your shoes, your lighting, your balance, your medicine? Let's help each other walk safer and stronger every step of the way.